Discuss about the uterus. Okay, now you guys know this is how uterus looks like. You know, this is the uterus. Let me highlight you. Okay, so this part which I am highlighting is the uterus. Now, in uterus, for our exams, what and all we should know. Okay, now let's start the parts. What are the parts of the uterus? Okay, now there are three main parts in the uterus. What are they? Body, isthmus, and cervix. These three are the parts of uterus. Now let's discuss, okay, one by one. Okay, now let's start with the body. Now the body of the uterus, okay, is going to have three layers. Okay, let me show you the body. Now concentrate here. So this is the body of uterus. Okay, now concentrate guys. All this which I am rounding up is the body of the uterus. Okay, now this area, okay, this small area, this is known as isthmus, and this part, okay, which I am highlighting, this part is the cervix. Okay, uterine body or corpus, next isthmus, next cervix. Now see here in the body of the uterus, we are having a layers. Outermost layer is known as a perimetrium. The middle layer, this middle layer is known as myometrium, the muscular layer. And the innermost layer, okay, this innermost layer is known as endometrium. These three are the layers of the uterine body. Okay, now let's come back. Perimetrium, myometrium, endometrium. The lining epithelium. Guys, the lining epithelium in the vagina is stratified squamous epithelium. In a newborn, it is a transitional epithelium. Now, the lining epithelium in the uterus is columnar epithelium. Okay, so columnar epithelium is the lining epithelium in the uterus. Okay, now let's discuss about the living ligature. Guys, we have discussed that the body of the uterus is having three layers: perimetrium, myometrium, endometrium. I have already said myometrium is a muscular layer. Okay, now this myometrium is a muscular layer. This myometrium, see, okay, let me show you. Now this is the myometrium. Now here the muscles are arranged in three groups. Okay, now outer longitudinal layer, okay, inner circular layer. Okay, now in the myometrium, the muscle fibers are arranged in three groups: outer longitudinal, inner circular. But in between these two, longitudinal and circular, there is one more layer in the middle. There is one more layer which is a crisscross layer. Okay, now the muscle fibers, they are interlacing, they are crisscrossing each other. Now this crisscrossing muscle fibers, or this crisscrossing muscle fiber layer, is known as living ligature. Okay, so what exactly is a living ligature, guys? Living ligature is the middle interlacing or the crisscross fibers in the uterine myometrium. Now once concentrate, these are the crisscrossing muscle fibers. Now why it is known as a living ligature? It's because, now see, in between these muscle fibers there are blood vessels. See, whenever this muscle fibers contract, they will, okay, they will close these blood vessels. So where it is important? Guys, remember, whenever there is delivery of the placenta, there is a lot of hemorrhage After the delivery of the placenta, the uterus needs to be contracted so that the blood vessels which are leaking, they will be clamped down. Now this muscle layer, okay, this middle crisscross muscle fiber layer, this muscle fiber layer is the one responsible for the shutting down of the leaking blood vessels of the delivery of the placenta. Okay, now living ligature, we have discussed all the important points. Okay, it is the middle muscular layer which contains the crisscross muscle fibers. Now cornua. Okay, what exactly is cornua? Guys, remember in this diagram, once concentrate, see, this is the uterine body, this is the body of uterus. Okay, this is the body of uterus. These are fallopian tubes. Okay, these are fallopian tubes. Now fallopian tubes are attaching to the uterine body. Okay, so this area is known as a cornua. Okay, now what are the important MCQ points we need to keep in mind regarding cornua? Okay, what are the structures attached at cornua? Now once concentrate in this diagram, fallopian tubes are attaching at the cornua. This ligamentous structure is also attaching to the cornua, and there is one more structure which comes and attaches to the area of cornua. What are they? Three structures will come and attach to the area of cornua. What are they? One is fallopian tubes, okay, round ligaments, and ovarian ligaments. Okay. Now these three structures will come and attach to the region of a cornua. Okay, but you need to also know the relations. What does I mean by? See, at the region of cornua, the fallopian tube, round ligament, ovarian ligament, they are coming and attaching, but the structures which attach to the cornua from superior to inferior, in the exam they will ask you, anterior to posterior. Now remember, anterior to posterior, the structures which are attaching to the cornua are first round ligament, okay, second fallopian tubes, third it's the ovarian ligament. Okay, please keep this point in mind. Okay, from anterior to posterior, it's the round ligament, fallopian tubes and ovarian ligament. Now from superior to inferior, now superior to inferior. Okay, now superior most structure which is attached to the area of cornua is fallopian tubes. Okay, fallopian tubes, ovarian ligament and round ligament, they are attached at the same level. Okay, superior most is fallopian tube, inferiorly at the same level ovarian ligament and round ligament are present. After this, what else we have to know? Okay, position of the uterus. Guys, I have already discussed the position of the uterus is anteverted and anteflexed. In the exam they will be asking you, is the uterus anteverted, retroverted, anteflexed, retroflexed? Okay, these kind of questions are possible. So the position of uterus is anteverted and anti-flexed. Okay, very important. Now, shape of the uterus. What is the exact shape of the uterus, guys? Uterus is something a pear like. Okay, pear shape. What is the weight of the uterus, guys? Here when we are discussing about the weight, we will be discussing the weight of non-pregnant uterus and pregnant uterus. The non-pregnant uterus weight is somewhere around 50 to 70 grams. Okay, it usually weighs 50 to 70 grams. But during pregnancy, uterus alone, the uterus, I'm not with the baby, I'm just talking about the uterus. The uterus weighs almost 1000 grams because the hypertrophy and hyperplasia of the uterine wall, it increases in its weight. Okay, now there is one more important MCQ they will be asking you. What is the weight of uterus immediately after delivery of the baby? Immediately after the delivery of baby, what do you think? What kind of changes will happen in the uterine wall? Uterus weight will still be the 1000 grams. Okay, suddenly after delivery, there is no changes coming in the uterus. It's still the same uterus. The baby is delivered before it is 1000 grams, even after it is 1000 grams. Okay, immediately after delivery. Okay, immediately after delivery, the weight of the uterus is still 1000 grams. Okay, now please never forget, very very important MCQ. Now the length of uterus. Here again in the same way, the length of a pregnant uterus is different, the length of non-pregnant uterus is different. Now length of non-pregnant uterus. Okay, the length of non-pregnant uterus is 6 to 7 centimeters, but the length of pregnant uterus will be almost around 35 centimeters. Very very important MCQ. Okay, now length completed. Volume of a pregnant uterus, volume of non-pregnant uterus. Volume of non-pregnant uterus is 10 ml. Okay, but the volume of pregnant uterus is almost 5000 ml. Okay, now important MCQs we have discussed. Okay, now let's discuss about the other topics. Okay, guys, in the uterus we have discussed the body part. Okay, so far we have discussed the body of the uterus. All important MCQs I have covered. Now let's discuss about the uterine isthmus. Guys, what exactly is uterine isthmus? I have already said you, but let me give you a clarity. Okay, so where exactly is this isthmic part present? Now we know what this is. This is the external os, and there is also an internal os. But internal os, here in internal os, we are dividing the internal os into two parts: anatomical internal os, histological internal os. Okay, so the area which is present between anatomical internal os and histological internal os, this area is known as isthmus of the uterus. Okay, now what is the important points you have to keep in mind regarding this? Okay, now once concentrate. What is the site? The site of uterine isthmus is above anatomical internal os, okay, below is the histological internal os. Okay, now next, importance. What is the importance of this isthmus? Okay, isthmus, it's going to form the lower uterine segment. As there is baby growing in the uterus, the growing baby needs a lot of space. For that, in the later part of the pregnancy, this isthmic part is going to form a new segment. It's going to form a new compartment that's known as lower uterine segment. Okay, now most of the lower uterine segment is formed by the isthmus. Okay, now importance is lower uterine segment formation. Okay, almost 70% of the lower uterine segment is formed by the isthmus. Remaining 30% will be formed by the cervix. Okay, now let's discuss all the important points about the uterine cervix. Okay, now what is the shape of the uterine cervix? Okay, the shape of uterine cervix is a cylindrical. Okay, important point you need to keep in mind. Now, let me show you two parts of the uterine cervix. It's the ectocervix and endocervix. Now, once concentrate, guys. The part of cervix which is coming into the vagina, the part of cervix which is coming into the vagina, okay, this is known as ectocervix, and the part of cervix which is present more internally towards the uterus, this is known as endocervix. Okay, now what important points we need to keep in mind regarding endocervix and ectocervix? Endocervix is lined by columnar epithelium. Ectocervix towards the vagina, it's lined by squamous epithelium. Okay, very important MCQ which was repeated more than 3 to 4 times. Okay, ectocervix, endocervix. Now, transitional zone. What exactly is a transitional zone? Transitional zone is the point where the columnar epithelium is converting into the squamous epithelium. Okay, so internally it's lined by columnar epithelium. Externally, like towards the ectocervix is lined by squamous epithelium. There should be a point or the junction between the columnar epithelium and the squamous epithelium. This junction is known as a transition. Okay, this junction is known as a transitional zone. There is one more name for this transitional zone. Okay, it is known as squamo-columnar junction. Okay, squamo-columnar junction is a point where the columnar epithelium is changing into squamous epithelium. Now, what is the importance of this region? What is the importance of this region? This is the site. This is the site where you can see most of the cervical cancer, CA cervix. Okay, the cervical cancer, the most common site is the transition zone or squamo-columnar junction. Okay, now a very important MCQ you should never miss. Okay, now shape of the internal os. Now, shape of the external os. See here, I just want to divide the external os towards the side of the vagina. Now, this external os in a non-pregnant female. In a non-pregnant female, the external os will look more circular. But in a female who have delivered through the vagina, okay, the female who have delivered through the vagina, the external cervical os will look more a slit-like. Okay, something like this. Okay, let me show you an image so that you will be getting a clarity. Okay, once concentrate here. Yeah, see this. So, this is an image which is showing the external os, a slit-like. This kind of a slit-like arrangement is seen in a female who have a vaginal delivery. Okay, please keep that point in mind. After that, let's discuss the other topics. Now, ratio of corpus to cervix. Remember, during different stages in a female's life, the ratio to body and cervix, the ratio between the body and cervix is going to keep on changing. Before puberty, the ratio will be something like this. Okay, corpus to body ratio is corpus to cervix. Okay, before puberty, corpus to cervix ratio is 1:2. Now, during puberty, it just got reverse. Okay, now corpus is going to increase in its size, so it becomes double, and cervix like 1. So, 2:1. Now, during adult or reproductive age, even the corpus of the body of the uterus is going more bigger. it will become a 3:1 or sometimes even 4:1. Okay. Now menopause, both the cervix and uterine body, they will get atrophied and they will be of same size, 1:1. Okay, a very important MCQ, like most of the time you will be getting one MCQ from this area. They will be asking you, okay, corpus to cervix ratio or body to cervix ratio. Corpus in the sense, corpus is the other name for body. Okay, body of uterus, body to cervix ratio. Guys, most of the students will be getting confused. They can even ask cervix to body ratio. Then you have to simply reverse the ratio values. Okay. Now after that, blood supply to the uterus. Uterus is getting its blood supply from simple uterine artery. Okay, uterine artery. Now very famous, repeatedly asked question. Uterine artery is a branch of anterior division of internal iliac artery. Okay. Now uterine artery is a branch of anterior division of the internal iliac artery, which is going to give the blood supply for the uterus. Now cervix is getting its blood supply from the descending cervical artery, which is a branch of uterine artery. Okay. Now nerve supply for the uterus. Nerve supply for the uterus is coming from the segments T10 to L1. Okay. Now nerve supply for the cervix. This is uterus. Now nerve supply for the cervix is coming from S2 to S4. Now what is the important MCQ related point you should keep in mind? Guys, remember the uterus, the uterine body, it is getting its nerve supply from T10 segment, T10 spinal nerve or T10 to L1 spinal nerve. Guys, if you want to have a painless delivery, then you need to block the nerve fibers which are supplying the sensory innervation to the uterus. So if you want to have a painless delivery, then you need to give the block from a T10 segment. Okay. So for painless delivery, the block should be given from the T10 segment. Okay. Now for instrumental delivery, see, if you want to apply any instruments, definitely you have to go through the area of perineum. If you want to use any forceps or vacuum, then you need to block the nerve which is supplying the perineum. What is the nerve supplying the perineum? It's the pudendal nerve. So pudendal nerve blocks pudendal nerve blocks will be given during instrumental delivery. Okay. Please keep this point in mind. Never forget. Very important point. Now, nerve supply is completed, blood supply is completed. Now, let's discuss about the development of the uterus. Guys, just try to recap from where exactly the vagina is developed. The upper 2/3 of the vagina developed from the Mullerian ducts and the lower 1/3 of the vagina is developed from the urogenital sinus. In the same way, try to remember this point: uterus, okay, a cervix, uterus, a cervix, a fallopian tubes and the vagina upper 2/3 part. All these are derived from the Mullerian ducts. Okay, so the development of the uterus is from the Mullerian duct. Okay, very important MCQ to keep in mind. Okay, now let's discuss about the fallopian tubes.